Welcome to part 2 of Survivor's Educator video series. In part 2, we'll be covering Survivor's student referral processes and trauma-informed considerations in the classroom. If you believe a student may be a primary or secondary survivor of torture, it's easy to refer the student by submitting a Survivor's student referral form. The student referral form can be accessed and submitted through our website, notorture.org. Once a referral form has been submitted, Survivor's expert client care team will contact the student's family to ensure the student is eligible and open to receiving services. We ask that referrals be limited to students who are from outside the United States or whose household members are from outside the United States. If you have any questions about referrals or our services, you can reach our offices Monday through Friday by phone or email. Aside from making referrals, here are some ways that you can incorporate trauma-informed considerations in your classroom. Trauma-informed care is defined as practices that promote a culture of safety, empowerment, and healing for severe trauma. It involves recognizing and responding to the effects of trauma and how it presents, and using techniques to support physical, psychological, and emotional safety for students who are primary or secondary torture survivors. We know that educators take great care in creating safe and supportive environments for all students. By incorporating trauma-informed techniques, teachers can help students regain a sense of security and trust, promoting their overall well-being. So, how can we create physical, psychological, and emotional safety in the classroom? Teachers can establish a safe physical environment by ensuring the classrooms are well organized, clean, bright, and predictable. Having clear routines and consistent expectations to provide stability and reassurance. Clearly explaining and displaying the entrances and exits to the classroom. Providing designated spaces for activities and a quiet space to retreat as needed. Allowing access to bathrooms and offering autonomy around bathroom breaks. Making space to respect cultural practices, such as times of prayer, especially for newcomer students adapting to a new culture, and respecting the personal space of students to establish physical and psychological safety. Focusing specifically on psychological safety, it's crucial to foster an atmosphere where students feel welcome, respected, and heard. Methods include properly introducing new students with icebreakers, using team-building activities to ensure that they feel welcome, taking advantage of interpreter services when available, allowing students to express their feelings, thoughts, and concerns freely, practicing and teaching active listening and empathy, and validating students' experiences when they have the confidence to express them. Emotional safety is another critical aspect to building trust and making sure students with extreme trauma feel secure and safe. Teachers can be trauma-informed by developing positive and trusting relationships with your students, demonstrating genuine care through small acts of kindness, greeting them warmly, showing interest in their lives, and providing encouragement. Using these gestures to build a foundation of trust, allowing students to feel secure in their connection with teachers and classmates. Trauma can leave individuals feeling powerless and overwhelmed. Teachers can offer simple choices and opportunities for autonomy, allowing students to make decisions within appropriate boundaries. This helps rebuild their confidence and self-esteem. While establishing friendships is vital to every student's experience, it's important not to force socialization. Remember to meet your students where they feel most comfortable. So, what can you do to address challenging situations and behaviors in ways that are trauma-informed? In the second part of this video, we provide techniques and approaches that you can use in your classroom. Students with severe trauma may present with anxiety and emotions that will impact their ability to focus and cause them to become easily overwhelmed, upset, or disengaged. When challenging behaviors or emotions arise, it's best to use as much discretion as possible and opt for one-on-one communication. This mitigates unnecessary feelings of shame and discomfort that arise from bringing too much attention to a torture survivor. There are several coping skills that you can model and encourage students to use. One technique you may employ is deep breathing with supportive touch. Allow your students to choose a comfortable position to place their hands, whether that be on their chest, over their wrist, or to give themselves a hug. Once they have chosen a position, instruct them to inhale and exhale 3 deep breaths slowly. Another technique is progressive muscle relaxation. Sometimes when the mind is in a state of anxiety, fear, or stress, the body tenses. Progressive muscle relaxation aims to reverse the reaction and bring the body back to its relaxed state. Guide the student to focus their attention on different parts of their body, starting at the head, and instruct them to tense each area for 10 seconds and then release in order to experience the difference. The last technique that we will cover in this video is imagery. Instruct the student to either close their eyes or look down. Guide them in creating a safe place in their mind where they don't feel overwhelmed. You can encourage them to keep imagining that place until they feel mentally ready to re-enter the classroom. These are only a few examples of the many trauma-informed methods that educators can use in the classroom. To learn more, visit notorture.org for free access to survivors' trauma-informed resources, training materials, and worksheets.